Welcome to my presentation on oral health and pregnancy. I'm Jenny Schuler. I'm an oral health educator and an oral health advocate. I'd like to thank the Washington Dental Service Foundation and Whatcom Community College for supporting this opportunity for me to bring this oral health presentation to you. So today we're going to talk about oral health basics and prevention strategies, the importance of oral health during pregnancy. We're going to explore some opportunities for guiding advocacy of oral health treatment and education for pregnant women, and look at some educational and referral resources. So I want to start back with the basics, and this may be review for you, but I think it's really important for us to remember about tooth decay process. We have bacteria in our mouth, and we feed it with our refined carbohydrates, the sodas, the energy drinks, the sweets, the crackers, the cookies, and that creates acid, and that acid is what attacks the teeth. And a key message here is it attacks the teeth for 20 minutes. So you really need to give your mouth an opportunity to neutralize. So keep that in mind, that process as we move forward. I also wanted to talk about gum disease, and we call the beginning stages gingivitis, and then when it gets more severe, periodontal disease. And you need to think about with pregnant women that they have a lot of hormonal changes going on. So gingivitis can be happening for them. Really important that they go in and see their dentist. And you'll see on that picture on the left, it's just the beginning of inflammation, gingivitis is. And it's caused by that bacterial plaque that sits on your teeth. And if you go in, you can actually reverse it if you're cleaning it well, brushing, flossing, maybe peroxide rinses. But if that plaque stays on your teeth, it becomes calcified. It's called calculus or tartar, and it attaches to your teeth and down underneath your gums and causes the bone and the gums to resorb. So then it's even more severe, and we really want to pay attention to that because that inflammation has an impact not only on our mouth but on our body. So when we think about prenatal oral health concerns, we know that there's 6 million pregnancies each year in the United States in women between ages 15 to 44. We also know that nearly 1 in 4 women of those ages have tooth decay. And tooth decay is the most common disease of childhood. So something to really put in your mind and think about as you work with your pregnant clients. And when we look at that periodontal disease, we can detect 37 to 46% in those women in those reproductive ages and up to 30% of pregnant women. So pretty prevalent, very key message for us to keep in mind as we navigate. I also wanted to bring up to your attention that there is a transmission from mom to baby. And I want you to educate those pregnant women here. Let them know that they actually can take the bacteria from their mouth that causes cavities and transfer it to their infant. And mothers who have a high rate of caries can pass that bacterial load, increasing the risk for decay for their babies. So lots of messages here. If we can delay decay for 2 years in kids, their caries score decreases a lot. So we really are recommending treatment and seeing the dentist on a regular basis. And I think another thing that comes to mind for me with pregnant women is we get cravings, and often it's sugar. And so our intake of sugar is higher, and therefore our oral hygiene may be lower. So let's talk about diet, because diet really plays a strong role in that decay process. So we want to talk about, with our pregnant women, to lower the sugar and the refined carbohydrates that they're taking in, and to think about having cheese or fruit or nuts instead as their snacks. So we want to encourage that healthy eating, and again, we want to get that message to them that it's important in that timing to give your mouth that rest beyond the 20 minutes. So not snacking all day long, not sipping all day long. That's the message that we want to get out there. So let's look at decay and risk factors for pregnant women. We talked about the high oral bacterial counts, the maybe frequent consumption of sugar, sugary foods, sugary drinks. They may not be getting enough fluoride, and fluoride really protects our teeth from decay. They may be in that low socioeconomic status that creates a lot of barriers to them for optimum oral health. And xerostomia may be a side effect that they are experiencing from a medication or a disease, and so that's when you don't have enough saliva, and saliva really does a lot for our teeth. It clears bacteria, it lubricates our teeth, it cleans our teeth, it helps us swallow easily. So really important to get that message out to pregnant women that they need to see the dentist because we can help them there in the dental clinic. They may have an existing restoration filling or an appliance where it's really easy to get recurrent decay that comes back again. So just some risk factors I think it's important for you all to be aware of. And prevention works, it's true. If we brush our teeth twice a day, 2 minutes minimally each time, and particularly right before we go to bed, if we floss every day to get the bacteria out from between our teeth, and using fluoride, mouth rinses, toothpaste, maybe it's in our water supply for strengthening our teeth, and certainly going to the dentist. And this is another key message we want to get out to pregnant women. It's not only safe, but it's really important for pregnant women to see the dentist, to have treatment, and get their teeth cleaned. So I wanted to talk a little bit more about fluoride. It's really highly recommended as stopping decay, preventing decay, and it comes in 2 different forms, either a systemic, which is the kind that you actually swallow in a tablet or a droplet form, or water fluoridation, and then a topical, which is in your toothpaste, in your mouth rinses. We provide topical fluoride at the dental office in gels. Fluoride varnish is a really great protector for particularly kids, I'd say adults too, that are high risk for decay. So lots of tips that you can share with your pregnant clients and help them see the importance of seeing their dentist. And when I think about oral health education, as you are talking with pregnant women, you can get that message out to them that dental care is very safe. And that we have other information, oral health information that we can share. It's a time when medical and dental providers can pay attention. So you can encourage your clients, your pregnant clients, to have conversations with both their medical and their dental providers about what's going on for them. And then we can offer tips and helpful hints. And they're also, as a pregnant woman, usually very receptive to know more about how can I take care of my oral health and what impact does that have on my child. And they also can have Medicaid dental coverage all the way through their pregnancy, and sometimes 3 to 4 months beyond, so that's really a benefit as well. So our studies and research are continuing to look at the inflammation of periodontal disease and how it impacts other parts of our body. And we are looking at other adverse pregnancy outcomes like preterm birth, low birth weight, etc. So it's really important to pay attention to that when you're having conversations with your pregnant women, to say, we want to make sure that we are taking care of you in the best way that we can. And again, when we look at dental treatment, in the past, it's been, I think there's still some people that feel it's not right. It's not safe to have dental treatment when you're pregnant. But the recommendations in the studies is that it is safe, particularly between the 13 and 21 weeks. And I think it gives an opportunity for those medical and dental providers to really collaborate and to encourage and support that pregnant woman throughout. So I would encourage you as navigators to really help your clients have those conversations, make those connections, that it's safe. We can do treatment during pregnancy. We can take x-rays during pregnancy. We'll cover your abdomen with a lead vest and protect you. And then know that there's lots of ways that we can help the pregnant women as they come in. So when we look at delivering oral health care, it's interesting to look at the medical providers, the prenatal providers, because during that 9 month of pregnancy, or however long it lasts, they see their prenatal provider probably 8 to 12 times. So that's a great opportunity for medical providers to give oral health education, to connect that pregnant woman with a dental provider. So that's a great opportunity, and I encourage you to encourage that to happen. And then when I think about other considerations for pregnant women, sometimes you might have a pregnant woman who has morning sickness, who is vomiting, and that's really acidic. So what we recommend is that they don't go in and brush right after vomiting, and that they rinse with a little bit of baking soda in water to just protect that their teeth, and then have them go see the dentist as well. Another thing that comes to mind, they may be higher anxiety, maybe a little more stress, maybe a little less sleep. So they might be teeth grinding at night, and we can make them a night guard to protect their teeth from that. And then that dry mouth that we were talking about earlier, what we call xerostomia, when you're pregnant, it's hard to stay hydrated. You really have to drink a lot of water. And probably even when you have the baby and you are nursing as well. So really important to pay attention to the amount of saliva there and what can we do to help them. So then when the baby is here, we want to encourage our mothers at that time to take care of their own teeth, and as soon as that first tooth shows up for their baby, to start cleaning that tooth and those teeth as they come in. With a little gauze pad or a washcloth, they make a little toothbrush that slips over your finger that's real soft. And certainly to get that baby to the dentist by the age of 1. Some medical providers will actually do an assessment, maybe a fluoride varnish as a protection if necessary, and they can look for early cavities and refer. Or you can just get them to the dentist and we can take a look at that. And it's interesting to think about because you think they're so small and it's going to be really hard because as a mother, you know how hard it is to look in your baby's mouth. But we have techniques that work really well, even when the baby is crying. That's the perfect time, actually, for us to be able to see. And it works. It really does work. And then again, some pregnant women have Medicaid coverage beyond when they've had the baby. And we also have a program called ABCD, Access for from birth to childhood, age 5, a little added coverage for kids in dentistry. So that's helpful as well. So when I think about navigation opportunities for you, certainly education, certainly prevention, and then teach about the oral health and its impact on your whole health. And advocate for dental treatment. Get that word out to the pregnant women, to all the providers. Get them a referral to a dentist or doctor if they need that. And then offer other resources as well. And I wanted to show you education resources that the Washington Dental Service Foundation has on their website. And you can actually go in and choose these brochures and order them for free. They'll send you as many as you would like. They come in multiple different languages, so it's a great resource. And then as far as dental care, here in Whatcom County, we have the Lummi and Nooksack Tribal Dental Clinics. We have an all-day-long Whatcom County Project Homeless Connect, 1 day a year where anyone experiencing homelessness can come for dental care, and United Northwest Dental Clinic opens up their facility, volunteers their services all day long, and takes care of the mouth. We have Seymour Community Health Center as well as Unity Care, which I mentioned. We have 2 dental clinics at the Bellingham Technical College. And we also have an organization called WAHA, Whatcom Alliance for Healthcare Advancement, that will work with you as a navigator or your client to find the resources and referrals that they need. And as I look at the state dental resources, there are multiple resources. 2 nonprofit clinics in Federal Way and Vancouver, multiple college dental programs where people can go and have dentistry done, usually for a little bit less than a private practice. We have donated dental care programs, Project Access programs, Union Gospel Mission, and then the community health centers are all throughout the state. And then there's this family health hotline that's sponsored by an organization called Within Reach. And their goal is that everybody in Washington State gets connected to healthcare. And so you can give them a call if you get stuck and you're looking for referrals. So thank you for being here today. Thank you for joining me and being an oral health champion. So thank you.